welcome everybody. Thank you so much for joining. And before we start, I wanted to introduce and thank Janice Spiso, who is on the call. Janice is our president and CEO of UCLA Health. Judy Fortin is the director of communications for UCLA Health. And Dr. Tisha Wong is the chair of pulmonary and critical care medicine. And Dr. Nida Kadir is one of our supporting physicians in our COVID long haul clinic. So we're going to just present our LA Opera UCLA Health collaboration in more detail today. And we have a couple of patients who have joined us that are going to talk about their experience. This is the list of our presenters. So Dr. Kristen Schwab is from the Pulmonary and Critical Care Medicine Division. I'm the Director of Therapy Services for the health system. Ernie Sacco is the Manager of Cardiac and Pulmonary Rehab. And then we have Michelle and Nani, who are from LA Opera and are our teachers of this program. And then Alex and Marcello are patient participants who are going to speak. So I'm going to introduce Dr. Schwab now, and she will start us off with our COVID-19 background information.
Great. Thank you so much, Ellen, for that. And thank you also for this. I have to say this, of all the projects I'm involved in, this is certainly one of my favorites. And so hopefully some of that will come through. I'm sure it will during this presentation from all of us. To start off with some background, we at UCLA have now treated over 34,000 patients with COVID since the start of the pandemic. For me, as a pulmonary critical care physician, this initially started out at the beginning of the pandemic, treating patients in the ICU who were critically ill on the ventilator. Thankfully now, because of vaccines, better kind of acute COVID treatment options available, it's shifted. And so now the majority of my exposure to COVID comes in the outpatient setting, where we found that over 20% of acute COVID patients will go on to develop long COVID. And that's a pretty conservative estimates, with many studies suggesting that it's closer to a third of patients. And so because of that, we at UCLA developed a long COVID team. It's a multidisciplinary team. It's led by our PCPs and then has specialists in a variety of kind of multidisciplinary specialties, eye and pulmonary. There's also a cardiologist, a neurologist, a psychiatrist, an infectious disease doctor, a rheumatologist, and more, who all kind of get together to really try to help these patients from this multidisciplinary standpoint. And the goal of this clinic is really to provide an individualized treatment plan for these patients and to connect them with resources. I'll go into some of that in the following slides. I wanted to start also by just talking a little bit about the challenges of treating long COVID, of which there are many. To start, it's a very heterogeneous disease. I've now seen hundreds of patients with long COVID, and I don't think there's any two who have presented identically. There's a huge array of symptoms that they can have, as is listed here, really starting from kind of the brain and going through the rest of the organ systems. And as you can see, these symptoms are oftentimes pretty big categories. Oftentimes in pulmonary, if we see someone with coughing up blood, there's a very kind of small group of conditions that can cause that. Here with COVID, there's something like shortness of breath or cough, where there's so many other diseases that could also masquerade as that. And so it can be quite challenged diagnostically to treat. Moving on to additional challenges. And so long COVID still has a fairly vague and loose definition. If you compare the definitions from various organizations, you'll see some discrepancies in terms of the amount of time that is required to pass between acute COVID infection and the persistence of symptoms to qualify as long COVID. There's also kind of no clear diagnostic criteria, which can make it challenging for providers. And along those same lines, there still is, as is the case with any kind of new and emerging disease, but there's limited knowledge about the best way to treat this. Unfortunately, this, I think, sometimes comes across to patients with the feeling of being dismissed. There's been so many patients who have come to me from other hospital systems, really actually across the country, people, coming from Florida to see me as their fourth opinion, just because they felt dismissed by 3 other doctors before me who kind of told them that most of their symptoms were probably all in their head. So there's a lot of stigmatization, unfortunately, with long COVID. And along those lines, there's also a degree of misinformation out there. Other patients coming to me after having seen some outside consultants without a clear medical license even, and being prescribed and started on all these therapies that really don't have much scientific data behind it. This fourth bullet point, it's kind of a perfect name in terms of long COVID, because it really, I think, highlights the fact that this really is a long haul type of disease where there's not going to be a magic treatment or magic kind of cure within weeks. It's going to take months and months of kind of patience and dedication to get people feeling better, which can be challenging for patients and providers. And then lastly, kind of along those lines, there aren't clear treatment guidelines, and there's really no disease-specific therapies like we have for acute COVID. There's nothing yet in the kind of arsenal for long COVID, which makes it very challenging to treat. Bridging from that, I wanted to talk about some of the ways that we have found kind of at UCLA to treat these patients. This is certainly kind of a no one-size-fits-all type of disease, and so it's very individualized and patient and symptom specific. I put a list here of a lot of the things we oftentimes include in our arsenal. This figure on the right is actually from a presentation that I gave to the California Thoracic Society about kind of how I approached shortness of breath in these patients. And not to go into the weeds of this, but just to show that there's really kind of specific treatments based upon the kind of associated conditions that seem most likely. But they can include medications, including inhalers or immunosuppressants or immunomodulatory therapy. Beyond the medications, physical therapy, and really kind of a structured graded exercise increase and exercise program can be very helpful for these patients, especially in terms of decreasing the risk of post-exertional malaise. Counseling and support groups can be invaluable for these patients. Pulmonary rehab oftentimes kind of combines many of the best parts of those prior bullet points to really help some of these patients who have persistent dyspnea or shortness of breath. And then lastly, as we'll talk about in the following slides, we found that the partnership with the LA Opera and this kind of LA Opera long COVID program has been tremendously beneficial for these patients in terms of helping with a lot of this breathlessness. And I won't go into too much more detail about that, but only to say that I've referred so many patients to the LA Opera who come back and with just rave reviews about how beneficial that was as an adjunctive treatment for them. And so has certainly been a great addition to our arsenal within the UCLA Long COVID Clinic.
Thank you, Dr. Schwab. Now, Ernie Sacco is going to talk about the program itself and start to frame this program we've set up.
Thank you, Ellen. Thank you, Dr. Schwab, and thank you, LA Opera, for this opportunity. So the benefits of the LA Opera program is really focusing on the breathing exercises, which increase the lung capacity and breath support. It helps the patients in terms of their overall endurance. One of the things that I think is the most beneficial part of this is the socialization and a sense of community. The COVID patients feel really isolated and kind of stigmatized by the fact that they've been labeled as a COVID patient. And bringing them together in this environment does help them understand that they're not alone and there's a group of others that are suffering from the same condition. And the great part about the class that LA Opera offers is that it is really a fun, enjoyable class with a scientific base to it. So it does give our patients hope and joy doing the class. So the way the program got started, it's interesting that Janice was pitched the idea by another singer, Rondi Charleston, that led us to LA Opera. I think Rondi saw a similar program in the UK and thought, well, why shouldn't UCLA be doing something like this? And so Rondi connected UCLA with LA Opera, which was an awesome connection. And then we started to talk about, what the possibilities were. And as we always do in the science world, we start with a pilot group and to gauge interest and effectiveness. And it was such a great program that we decided to continue the program, and we offer 6-week cycles. And so we've completed 7 6-week cycles to date. So the way the patients are referred right now is that they're either part of our pulmonary clinic or our pulmonary rehab. They definitely have to be medically stable. One of the things that's great about this type of class is utilizing Zoom, which we couldn't do this type of class in our clinic right now because everybody is wearing masks. We couldn't get people to expel air still with the pandemic among us. We have to be careful about that. So doing it in the Zoom platform where people are at their home allows us this environment, which is perfect for the class. But they need to be medically stable, have some interest in music and singing. They don't have to be great singers, but they just have to know that they're going to be doing a little bit of singing, as that's part of the exercise. And then participants are registered and sent consent forms, pre-participation surveys. We give them song lyrics that they're going to be learning in the class, and various other helpful tools, straws, cups, TheraBounds, and other UCLA, as we call it, swag. And then I'm going to turn this over to our fantastic teachers from LA Opera, who will explain the structure of the class.
Good morning. Good morning, everybody. My name is Nani Sinha, and I co-teach this class with my incredible colleague, Michelle Patsakis. And we're just going to go through a little bit of the program structure and the participant guidelines now. This is really important because for those of you that are not singers and don't know, the voice is the only instrument that you can't divorce yourself from. You can go get a brand new piano, you can get a new guitar, but your voice is you. So it's very unique and special. So this time we say is non-judgmental. It doesn't matter if you sound like Ms. Fleming or if you sing for fun in the shower and only your dogs and shampoo bottles hear you. It doesn't matter. This is non-judgmental, and it's to have fun and relax. That's the biggest portion of this. Every time we see our patients, we say, do the very best you can today. Every day will vary. Maybe we'll have an uphill great sprint and all of a sudden you're feeling fantastic. And then the next week we see you and we've taken a few steps back. This is normal and it's okay. This is okay. We're all here to support each other. Another important factor is to have another adult in the house, because sometimes we think we're doing a really great job and we'll just push that extra little bit. And all of a sudden you're winded and you can't quite make it to the chair. But we have lots of protocols to make sure that everyone is safe and still having fun. We regularly do check-ins. Michelle and I will do thumbs up, thumbs down. We're doing okay, to check in to make sure that we're not pushing beyond our limits. And we're modifying classes as we go to incorporate sitting and standing as our energy continues to grow, or as our energy takes a couple steps backwards. Again, totally normal. Those of you who have ever had to recover from any kind of an injury, you'll know that you take a couple steps forward and then maybe a couple steps back, but eventually sticking through with it gets you where you want to be in your recovery. And we also say take a break when needed. You don't have to do everything. We don't have to be the superstar that runs to the furthest and the farthest. It's all about meeting everybody where they are on that day. We start all of our programs with the wheel of emotion. So again, meeting everybody where they are. So sometimes we're meeting people who have had a frustrating diagnosis or an experience for the day, or have to schedule a surgery. And that makes them not exactly in the happiest of moods. And sometimes we're meeting people who are very hopeful and very excited for the day. There is room for all. We do a little welcome and we do an introduction. We get new participants all the time. This is a 6-week class, but as people keep getting referred into the class, sometimes we meet people on the very second to last day, or we meet people at the very beginning, but not to worry. We usually have another session starting up within a week. So we do our check-in with the wheel of emotions, and then we start a mindfulness practice. And mindfulness is so important because for those of you that know that work on the clinical end of this, you can have a respirometer and ask somebody, okay, slow exhale, let's do it. We're in the hospital or we're in the rehab facility. The lighting is not necessarily cozy. It's not familiar for the patients. It's a different environment, an environment that is there to provide medical assistance. We're finding with people in their homes, they're surrounded by their cozy things and their stress level drops a little bit. So we put in this mindfulness practice because all of a sudden we're maybe a little nervous about singing. We're nervous about expectations of the class. We're nervous about what we're going to be doing. Will I be able to do it? I used to be able to do this, but now my body is failing me. No more. We're going to check in with our body, and we're going to make sure that our body and our mind are aligned so that we can proceed with our breathing exercises with that level of comfort in the body to calm and accept one's feelings and really engage with all the sensations of the body.
Thank you so much, Nani, and it's wonderful to be here again. My name is Michelle Patsakis, and I'm an opera singer, and it's wonderful to be able to bring these things that we know as opera singers to our participants in this class. And basic and foremost, we have our posture and alignment, which as opera singers, we know our bodies are our instruments. And if our rib cage collapses, our shoulders are slumped, our body is not anchored, we know we compromise our abilities. So the posture and alignment are critically important. So one of the methods we use is the Alexander technique. It was created by an actor over 100 years ago when there was no amplification in the theater, and he found he was losing his voice and discovered it was due to posture and alignment. So it includes kind of 4 basic elements that we always try to touch upon. First of all, kind of going back to the mindfulness, is awareness. So to just scan your body and know where are you right now and how can we adjust it. So some adjustments we make are getting tall, that elongation, having our shoulders not be slumped forward, our back not be arched, but finding neutral shoulders, neutral hips, and having flexibility with our body. So in order to have the good posture, we also need to strengthen our muscles to support our posture and make our posture position that is optimal habitual. So we also do exercises to be able to maintain this wonderful open rib cage and this tall, elongated position. So we're stretching, we're doing exercises and establishing this optimal alignment before we start our breathing exercises, which include, as you can see from this picture, straw phonation and straw breathing. Straw singing is part of a semi-occluded vocal tract exercise regime. Semi-occluded, partially blocked, occluded vocal tract exercise is used in speech pathology and vocal pedagogy. It was developed by voice scientist Ingo Tietze in 2006, and they knew that it helped improve vocal economy, and it's used in singing because it engages all the subsystems of the voice. It helps with easy phonation, it reduces vocal fatigue, and it facilitates resonant voicing. And it allows us to focus on sensations and sort of distracts us from the breathing. And it includes humming, trills, and the straw. So this is related to pursed lip breathing, which has been used for COPD treatment, which we know improves ventilation, releases the trapped air in the lungs. It keeps the airways open longer, decreases the work of breathing. It prolongs exhalation to slow the breathing rate, which helps with anxiety. And it improves breathing patterns by moving the old air out of the lungs and allowing for new air to enter the lungs. It relieves shortness of breath and causes general relaxation. So part of this we include sometimes together with the straw is box breathing or square breathing. It's used for anxiety reduction and for therapy with lung disease. And the method is generally that we form this box. We inhale for, let's say, 2 counts, and then we suspend or hold our breath for 2 counts, exhale for 2 counts, and then either hold again for 2 counts or exhale for 2 counts. So we're forming this box, and then we're increasing slowly in an exercise, going from 2 counts to 3 counts to 4 counts. In the class, we've gone as high as 5 counts, just depending on how everyone is feeling. And again, this slows the nervous system, but also is helping with lung capacity and efficiency. And it simulates what we do in singing, where on that exhalation, we're slowing it and exhaling over a long period of time. And then yoga techniques are part of our posture and alignment. For example, cat-cow, where we're doing things like this. And then again, in part of the mindfulness. So yoga uses chant, uses humming to feel vibration and bring in that kinesthetic along with the spiritual, that we're trying to be very holistic and include all the systems of the voice, but also our mind and our emotions. So then we go into song practice. We're bringing this together. We're doing some vocalization after the breathing exercises where we're combining our posture, our breathing, and then starting to sing with some traditional exercises. But then we want to make it fun, and we do songs, and we use familiar and simple songs with positive messages. And then we also, learn new songs. We've done multiple language because opera uses many languages. And in our classes, we've done Hawaiian, Spanish, French, Greek, and spirituals to be inclusive with our repertoire. So for example, we've done Down by the Bay, which is a traditional English song, which was made famous by Rafi. So many children know it and many parents have taught it to their children. But it is also a Greek folk song, which I think originally was a Greek folk song called Yalo Yalo. And so I introduced it being of Greek descent. And lo and behold, one of our participants is of Greek descent who happens to be with us today, Alex Fotopoulos. So I've asked Nani if we could just have a short demonstration, if she could open up her microphone, and I'll just demonstrate, and Tate will put into the chat the lyrics for the song in phonetics to just kind of show what we do and how we can all participate in that class. So, yalo, yalo,
Yalo, yalo,
yename,
yename,
yolo yase,
yalo, yase,
nalegame,
nalegame,
yalo napos,
yalo, napas,
yalo narthis,
yalo, narthis,
alo yamu,
yalo, yamu,
nathimithis.
Adimithis.
So hopefully you all recognize that as being down by the bay where the watermelons grow. So again, kind of fun and wonderful and fun for us to participate with our classmates singing these new songs and new languages.
Absolutely. Thank you, Michelle. And I just have to say, it is always a pleasure to sing with our participants. Like I said, some people may be at the level of Ms. Fleming, and some people may just be singing with their shampoo bottles, but everybody is smiling by the end of it. So I just want to address a couple of things. Why do Michelle and I do this and not everybody? Michelle and I have worked really hard in our lifetime to garner information, whether it be personal or it be through our doctorate program, as Michelle has a DMA. And some of the things that I have gone through in my life, I broke my back in 2008. All of these extra modalities that we've brought in, yoga, EFT tapping, pranayama, are things that I have used to work through my own pain and anxiety, and then brought it into working as a professional singer for competitions and for opening night jitters and for all kinds of things, session work where they throw music at you last minute and all of a sudden you have a panic attack and you think to yourself, how am I going to manage this? This is how we manage it. These are all things that we do to get through and perform at our optimal level. And one of these things is EFT tapping. Emotional freedom technique tapping, and it was developed in 1996 by Gary Craig. It's a relatively new modality, but it's very similar to acupuncture, where it focuses on the meridian points or energy hotspots to restore balance to the body's energy, reduce negative feelings, reduce anxiety, and promote overall well-being. It's based in Chinese medicine. The meridian points, if you're not familiar with them, are thought of as areas where the body energy flows through. And this is very similar to when we go into yoga or we go into pranayama breathing. These pathways help balance energy flow to maintain your health. We know that the brain can control your stress. So if we change our perspective and our emotional response as well as our neurological stimulus to what's going to happen, all of a sudden we can accept more information. So the EFT tapping, I'm just going to go through it with you very quickly. The technique that we use, this is part of our mindfulness. And it's again, creating that elongated posture, releasing any tension from the body, and then beginning to tap at either the speed of the patient or at the speed of the teacher, the practitioner. So tapping on side of hand and creating a sense of well-being. This tapping that we do, it re-regulates our nervous system. So it tells us we're okay, we're safe. This tapping, this rhythm, this regular rhythm. We also then move to top of head, inside of eye, outside of eye, under the eye, under the nose, under the chin, at the clavicle, and ending under the armpit. So as we're tapping through, we try to experience breathing lower into our body, possibly going into the hip crease of our sitting position, expanding our ribs, expanding the back, because as we've seen with our patients, often with the coughing, if there brings tightness, and we have this tight stance that we're working with. So opening everything up, opening up the space in between the intercostal muscles that have been cramped and sometimes atrophy or are so tight we can't get them to release. So using this to just bring a sense of well-being and openness, what we're trying to promote. So this way, when we get into our breathing techniques with the box breathing, no one is clenching. Everybody just feels suspended and animated. One of the other techniques we use is pranayama breathing. Pranayama is the yogic practice of focusing on breath. In Sanskrit, prana means vital life force and yama means to gain control. What a better thing are we trying to do, right? With our breath, we're trying to gain control. This breathing means to elevate the life energy. Before we were talking about in EFT tapping, elevating the life force, right? Same principle. And it is the practice of controlling your breath through alternate nasal breathing. So breathing in through your right nostril, exhaling through your left nostril. And sometimes we find that as this happens, we are working with both lobes of the brain, and it gives your nervous system a chance to calm down again, re-regulate, and regain control. As far as studies go, we're in the midst of it. We're in the midst of studying what pranayama does, but we do know that research shows that the effects of pranayama are overall beneficial to well-being and beneficial to as a calming technique. And now I'm going to turn it over to Michelle again. Thank you.
Thank you, Nani. So she was talking about pranayama breathing. One of the things that we do with that is, closing one of the nostrils and inhaling through just one, which sort of simulates this slow breathing that we get with the straw by inhaling through the straw and exhaling through the straw. But opera singers, we can't be on stage and inhaling through one nostril or a straw. So we have to learn sort of more rigorous, breathing support and techniques to fortify us for doing that really dramatic singing that over the orchestra that we need. So most people don't think about how they breathe. And so bringing awareness and having strategies and being able to practice them in class in a fun way is really helpful. And for me, just like releasing our bellies, because I'm always holding my my stomach in. And so just like having a place where we all just breathe and release our belly and understand the laws of physics, that nature hates a vacuum and the lungs will fill if you open your throat and drop your belly. So just something as simple as that is very, very helpful. And then also knowing that we don't want to have clavicular or high breathing, and we want to have this low breathing, abdominal breathing. Some people will say, breathe from your diaphragm. We actually can't breathe from our diaphragm. The diaphragm is a dome-shaped involuntary muscle that sort of divides the abdominal cavity at the base of the rib cage. But when you inflate your lungs, the diaphragm will drop and push the viscera out. And in the uncaged part of the abdomen, where the organs can all just sort of come out like an inner tube, 360 degrees around your body. And so this is where we're focusing on really having that low connection with your body and your breath. And again, practicing that in class and not having that sort of high rescue breathing and panic breathing, which can be anxiety provoking also. So a poggio is a gold standard for opera singing breath support. It's from the Italian, which means to lean. And it is was Richard Miller defined it. He was a pedagogue, and he said it was an establishment of dynamic balance between inspiratory, phonatory, and resonatory systems in singing. And that's, if you can see, like everything that we're trying to do. We're trying to create this coordination and this balance, and then suspending that exhalation by having this support to sort of lean against. So I think it's very dynamic. It's very interactive. That is what we seek to sort of cover in our work in the class. So thank you so much. And I will turn it back over to UCLA Health. Thank you.
Thank you, Michelle and Nani. The two of you are amazing. And now we're honored to have two of our participants joining us who are going to just talk about their experience and challenges and benefits of this program. So Marcello, do you want to start? I think you've been participating since the very beginning, right?
Yes, I'm a charter member of the Friday morning group. I think it's a fantastic thing that you're doing, all of you. I want to thank at this time UCLA and for bringing me back. I'm sorry. Listening to that CNN gave me a little bit of reminder of what happened, but I wasn't as bad as that man, but it was close, almost a month at UCLA, Santa Monica with Dr. Smith and Dr. Young. And afterwards, participating in the rehab at UCLA with Jonas was a wonderful thing. And because of that, I found out about the LA Opera program. And I've been there since the beginning and continue because I love to sing. My wife plays the piano, I sing, play the trumpet, but COVID kind of stopped all that for a while. So I'm trying to recover voice and enjoy life again. And I had a lot of the side effects that were listed. And from the eyes, 2 cataracts and pacemaker and a lot of things that happened that we don't know at this time what the effect of the COVID remains on the body, you know, and it's constant that we are trying to find out more about it. But I'm just blessed that that I have this resource, and I think that on top of that, I think there's a tremendous need for some group psychotherapy to deal with the other effects, the depression. I am blessed to have a wonderful support, but individually, we go through all these PTSD things, and so far we haven't been able to find a group that would do that. So I hope that they can put something together for that effect, and we continue working with the LA Opera and UCLA, putting together the group. It's been very emotional. It's very uplifting every Friday morning when we see each other. But at the same time, we see that other people have dropped out and they come back and they've had bad experiences again. So we're dealing with an unknown that is very scary. And, you know, I think that I just hope that we can find ways of you know, rehabbing and having people feel better and continue with their lives. And I'm very lucky to be where I am and have the resources. And with UCLA and the LA Opera program, it's a constant, you know, way of having therapy and recovering your voice. And I think that's all I need to say. And thank everybody involved. It's wonderful to have you.
Thank you so much, Marcello. Your words are very moving. So, and now we have Alex, who is another one of our participants.
Hi, everybody. I just want to say thank you as well and reinforce everything that Marcello said. Just a little bit of background about me. I got COVID in January 2021. And a friend of mine, I was sick for about a week. A friend of mine brought over a pulse oximeter for me to use. And I was always a B student, so I got an 80, and I was like, okay, this is an 80. Great, it's fine. It should be okay. A friend of mine who's a doctor who actually was a resident at UCLA in the 90s, I talked to him, and he said, if you are below 90, you need to get to the hospital right away. And I was like, come on, I'm not going to go to the hospital for that. It's a decent number. He's like, no. Went to the hospital. 3 months later, they're asking me who the president was and who and what month it was. And I had no idea. And basically my answer was, the last time I remember, there was a debate about who the president was. And it was February. And they were like, well, both answers are wrong. So I couldn't move. I couldn't even sit up. It was 3 months that I was in a coma. And I was very lucky that I ended up going to the Helen Hayes Hospital. I was in New York at the time. And the hospital was amazing. And they did an amazing job in recovery, but I still couldn't breathe. I still had trouble breathing. One of the therapists was doing this exercise with me, just going ah. I couldn't do that for more than 3 seconds. They gave me that incentive spirometer, and they were like, "This is what you need to do." Can I tell you, I hate that incentive spirometer. If I had to pick one thing that I want to throw out the window, it was that thing with the ball. So I was like, there's got to be something else that I could do. And they said, well, go see a pulmonologist when you get out of here. The first thing I did was go see my pulmonologist, the guy who did the trach. I had to have spikes put in my lungs because my lungs collapsed from the Actemra. I guess they gave me Actemra, was one of the drugs that I got. So I said to him, well, there's got to be some drug I can take. I saw all these asthma commercials in the hospital. I think the hospital TV only plays like medicine commercials. And I was like, there's got to be a pill. There's got to be something. And he was like, no, there's nothing. And he's like, you're just really lucky that you're alive, because only like 10 to 15 people made it out of there alive. I was in the ICU at Holy Name Hospital in New Jersey. And so I was like, okay, well, thank you, doctor. I'm glad I'm alive, but there's got to be something I can do. He said, come back in 2 months. Oh, and by the way, you only have 3 to 5 years to live based on what your lungs, what your x-rays show. I was like, my sister was with me. So I was very lucky, because I walked outside of the parking lot and I looked at my sister and I was like, did he just say I had 3 to 5 years to live? And I was still like perplexed. It was like a whirlwind. She's like, yeah. I said, okay, well, my kids always tell me that Google is my friend. So I went home and I just started Googling stuff. And I somehow, the London program came up in the UK. So I started reading about that. And I said, let me check this opera thing out, because the Oz was always helping me. And I thought maybe singing, because I'm a lawyer. So I was like, I need to be able to speak. I need to be able to talk in court. And I started looking into that. I reached out to London and they said, we can't help you because it's in the UK. You're not in the UK. And I was like, I live in New York. There's got to be something that I could, a New York opera, something here. Nothing. Somehow I think I might have saw that CNN thing that we just saw. Somehow I found out about this, and I went to law school in Los Angeles. So I said, hey, this is a good excuse for me to go back to California. I reached out and spoke to Joe Van Vliet, and I want to just say his name because he responded right away. And one of them, like Marcelo said, one of the most frustrating things is that I know that COVID is new. I know that there's like not a lot of things about this, but I saw so many shrugs. I mean, when you go to the pulmonologist and he just says, there's nothing we can do for you, and moves, shrugs his shoulders and says, that's it. I'm like, there's got to be something. So when I talked to Joe and then I talked to the people at UCLA, it was a blessing, because they had a plan. Maybe the plan is, maybe they don't know what's going on, but there's a plan. And that was so impressive. All the doctors at UCLA had a plan, and they gave me, here's what we can do. And it was reinforcing. And then they mentioned this program. And I said, okay, that's one of the reasons why I reached out to you guys. I wanted to see if this could help, but I can't sing. I was like, there's nothing I could. I can't even carry a tune, no rhythm, no nothing. And they were like, just try it. And I said, let me go and sit and do it. In the first class, it was a little overwhelming, but I heard Michelle and Nani sing. And I said, if all I do is listen to these two beautiful women sing with their beautiful voices, it's an hour well spent during the week. And it was great. And I'm not touchy-feely, and I'm not really into the wheel of emotion and all that stuff, but it really makes a difference. And I really got to tell them thank you, because that stuff really works. I'm convinced. You know, they sold me. And in fact, one day I was in the car and I said, I don't remember all the songs. I don't remember the Yallo Yallo that Michelle sings, although I'm Greek, so I love that song. But I just started making up my own song. I just said, I know when we do some of these things, I feel better. I had trouble breathing, so I just started going, ha, ha, ha. I wish I could sing. I wish I could sing. I just made up my own little song. And, and I just was like doing the exercises as we did it. And I started coughing and I felt better and I could breathe better. And my lungs expanded, and everything that they showed me, I put into play. It comes to you. It's like when they get you to consciously think about this stuff, you start thinking about it during the week. So even though it's only a 1 hour class, that week, I think about little things all the time. And everything that they've talked about has helped me tremendously. And I just think that this is really a great thing. And it's great that there's a plan. There's, UCLA has a plan. This fits into the plan. And it's like, I feel like I'm going somewhere and I'm improving. I mean, I couldn't even talk this long 6 months ago. So I just want to say thank you. And I ditched my incentive spirometer. So
Alex, thank you
an awesome job. Thank you very much.
Thank you so much.